As we all have heard personal stories on this floor, and many of us have not gone untouched by families suffering from mental illness. When we speak about this publicly, it always offers the opportunities for others to engage and voice their stories and narratives about community members, family members that have suffered from mental illness. I wanted to speak today in the perspective of students. We know that as we go back a few years ago and we see the impact of the pandemic on our students, that we had many, many students that fell into depression, and really that was real. But we also know there are communities, many times communities of color, that don't take mental health issues seriously. It's often not talked about, it's stigmatized, and we also know that there are not very few resources for families who are struggling, whether it's seeking a counselor, getting an appointment, getting medication. These are all scenarios where one needs to seek out help, and getting that help is often elusive. It's often can change, as was noted with medication. Somebody might get on medication, they don't get the prescription filled, and then they fall backwards. All too often we talk about homelessness here on this floor, and we talk about, well, those individuals are all taking drugs and that's why they're homeless. Often paired with homelessness are people taking drugs, but also suffering mental illness. There are co-occurring issues that people suffer from. But going back to our young students, representing Orange County, we have one of the largest children's hospital, CHOC, and they opened up an adolescent wing about 5 years ago. And it was with great cheers. But when you ask the question why did we need an adolescent wing in Orange County to add further patients? The number one issues that we're seeing, again, young women, young girls. We're talking under the age of 12 who are cutting themselves, who are depressed, who are suicidal. So we are losing our youth to suicide. This is real, and we can do something about it. We can do it by the values we put forward in the budget that is coming forward. It is our obligation to put these issues on the table and not stand for delays and cuts, because we know that that will result in deaths. And with that, I ask for your support for ACR 185.